First speaker for the Urban Health Collaborative, invited speaker for this year. We have several more lined up, and there's a little paper there. Let me tell you a few things about, before I introduce Manuel, let me say a few things about our upcoming speakers. Dustin Duncan is an epidemiologist, I guess. I'm not sure if he's formally on it, but he does a lot of very interesting work looking at built environment and health, and also using mobile devices and tracking people and the more spatial dimensions of that. He's coming from NYU. It'll be very interesting. And then we have Jason Coburn, who is also terrific. He's an urban planner who has worked for many years in sort of community engaged city planning. He has a terrific book. I can't remember the name of it right now, but he does work both in the U.S. and abroad, in Africa, in Latin America, and it's a very community engaged, citizen participatory, co-production approach to urban planning and health. So he will be terrific as well. And there'll be opportunities for you to meet with all of these people if you're interested when they visit. And then we have Larry Cohen, who's the founder and executive director of the Prevention Institute, which is a very well-established institute that has been at the forefront of many interesting, population health and prevention activities. So I encourage you to join us for those as well. So today it's my pleasure to introduce Manuel Franco. Manuel is an associate professor at the School of Medicine at the Universidad de Alcalá in Spain, and he's also adjunct associate professor with that other school just a few miles away, that up-and-coming school. So Manuel trained originally as a physician, right? And then he spent some time in Germany, didn't you? And then he came to Hopkins to get his PhD, and that's where I met him when we connected about a project he was doing to look at food access in Baltimore. And he did some very interesting work at that time for his dissertation, including some assessment of food stores and combining that with some MESA data and some other data. And since then, he's gone on to really build a very interesting research program in the whole area of neighborhoods and health in Madrid, in his hometown, right? And he has a very good group working with him. We have several members of the group there in the back. You can raise your hands. Sama, Pedro, and Julia, and they're visiting with us today as well. And I think a very interesting aspect of the study, Manuel has spoken about a study to us before, but a very interesting aspect that really combines not only quantitative approaches, pulling together different kinds of data sources in many ways similar to what we're trying to do with the Urban Health Collaborative here, but also qualitative approaches. And so he's going to talk about some of that aspect today. And what we'd really like to also build on after this visit is think about exchange opportunities between the groups. So there are mechanisms that we could request funds through Spain, and potentially we could think about ways that we could contribute as well to establish exchanges of faculty and students. So if you're interested in that, or if you have people who are interested, be in touch with me, and we'll try to set up some formal mechanism, because I think there might be some interesting things that we could do. So, take it away.
Thank you very much, Anna, for the introduction. It's a great pleasure to be here once again. This time presenting a spin-off of the original large European project. The project is called the Heart Healthy Hoods, the Triple H. And we tend to go all together, so that's where we never walk alone. There's four of us today. It's a true pleasure to be here. Pedro is the first official exchange with Drexel and Universidad de Alcalá, and I hope that it will be the first of many. So I will talk today about this participatory action research project focusing on the food environment in Madrid, in the district of Villaverde, which is in the south of Madrid. As Anna introduced before, I was lucky enough to work on that during my PhD project in that town south of the border, and in that school, where I was lucky enough to get funding for doing extra data collection on specific food stores. And that translated into a couple of articles that related to how food environment relates to or affects dietary patterns in Baltimore residents. Very interestingly, and I think interestingly for you guys, given the ties that you have to the health commissioner and the health department here in Philadelphia, as soon as I finished my dissertation, I went to the city health department and presented our results, and the city health department was very interested in this. And very rapidly, for the first time ever, they got together the urban planners and the health people, and that was Josh Sharfstein, that later on now is faculty in Hopkins, and that I thought it was very interesting that they even got that into a paper that says Franco presentations to George Sharfstein in September 2007.
Oh, wow.
So he made really tough questions to me, and then it all started at that point. And now Baltimore has a food policy group that links not just researchers but also local administrators. So, as I told you before, we were lucky enough to get this type of neighborhoods and health research in Madrid as part of the Heart Healthy Foods project, and this is the title. So the main idea of the Heart Healthy Foods project is to focus for 5 years and develop a whole research team focusing on how the city relates to cardiovascular health of the residents in Madrid, and in very particular working on 4 domains of the environment: tobacco, alcohol, food, and physical activity. When we talk about how those domains relate to cardiovascular behaviors, we thought in terms of qualitative work run by sociologists, in terms of what are the social norms related to these behaviors, but also the actual resources that are in relation to those behaviors. And that was the main goal of this large project. So when we thought about that, specifically working on food, which is what I was doing before, we have published a couple of papers, and one that I wanted to mention is the idea that we could compare cities by developing a metric on identifying neighborhoods in different cities. And we published recently a paper on how the healthy food availability is very different from one city to the other, in this case Baltimore and Madrid, because in Baltimore, where I was working, they continued collecting the data, the same type of data that we were collecting in Madrid. So we also, and all those papers are available in our webpage, developed a kind of metric of how to understand all those different domains in one particular neighborhood in Madrid. And again, I think that was very interesting that we were trying to mix both qualitative and quantitative data. For that, there's this approach of mixed methods that some of you in this house have been developing and working on, and that's a new way of for us to put together all that information. Having said that, we're working on food environment in Madrid, but Baltimore City has done a lot of work on identifying and classifying and understanding the food environment. And I know that here in Philadelphia, there's also has been a lot of efforts on understanding not just the food environment of one place or the other, but also the food environment as a whole system for the whole city. And this is where we are struggling and working right now. For that, we thought that so far we had used quantitative direct observation data collection. We had used qualitative work, but we didn't have got yet the perspective of the residents. And for that, the participatory research approach was very interesting, and we were very interested in on doing that as a pilot study or as a unique study in one of the districts of Madrid. We think that that type of information is absolutely necessary to when you are to implement and design interventions that, in this case, the local authorities, the city hall, could develop in Madrid. So, for that, we, researchers, we always ask for money every week, every month. We write a grant, sometimes every 2 months, but we get it once a year. So this is what we did on the top of that European project. We asked for a small grant, specifically to develop this Photovoice project in the south of Madrid, focusing on how the food environment relates to people's diet or to residents' diet. That was the main objective of this project. The specific objective was to use Photovoice to describe what are the main themes that people in this area characterize the local food environment in relation to the residents' diet. And this is our first publication that hopefully will come out very soon. And this is also a reflection of the photo book that we are circulating with you guys. There's 5 or 6 of them that you can download from our webpage. We will collect them at the end. Only some chosen ones will get the book. We will disclose at the very end who are the chosen ones. It depends on your questions. So that's the first objective. The second objective is how can we translate all these results and all this knowledge into recommendations for the local administrators. And we have done that, and we are on the way to publish that. And finally, and very interestingly, and we were talking about that this morning with your students, this study is set to communicate and disseminate these results from the very beginning. And one way of communicating these results is the photo book, other ways the exhibition, other ways I will tell you later on. But we thought that a very interesting or important part of the project is how do we disseminate this participation to the society or population in Madrid, and also to the local administrators. So Photovoice, probably many of you have heard about that. Some of you have already used it here in your faculties. It's a participatory action research method that was brought into public health by people in Caroline Wang and Marianne Berries in Michigan, actually. And mainly Photovoice enables people to identify, capture, and most importantly, reflect community concerns. And the way this is done is through photography. And photography plays a very important role here in this project, and that's why photo book exhibitions and having a good photographer is a very important part of this. Finally, Photovoice has the mandate of informing policymakers, in this case, to promote healthy food or healthier diets. And you will see plenty of pictures of our participants and the pictures that they took. So we did this in the south of Madrid. For those of you that know Spain, Madrid is in the very middle. That's the region of Madrid, and that's the city of Madrid. It's a city of 3.5 million people. The whole metropolitan area is 5 million people. In the south of Madrid is the district of Villaverde. It's a low-income area, white-collar, white-collar or blue-collar? When I said that, it's 7 years that I left Baltimore. I get confused with the white and blue. So post-industrial neighborhood district in Madrid with lots of factories that have been closed right now. Used to be a town outside Madrid, and now it's a district is connected by buses, public transportation, so it is the city of Madrid for everybody right now. Very underserved area of Madrid with many different problems. Large district in surface and 5 neighborhoods within the district. So I'll show you more data on socioeconomic demographics right now. So we work on 2 of those 5 neighborhoods, Los Rosales y San Cristóbal. And what we did is we recruited, engaged participants in those 2 neighborhoods, groups of men and women. In one neighborhood group, another group of men and women. We aim to have 6 men and women in each of the groups. And we worked on this through a very tight collaboration with the Madrid Institute of Public Health. In Madrid Institute of Public Health, I was telling before some of you, so many meetings that I don't remember exactly who. The city hall does not take care of the health care providing of the city in Madrid. It takes care only of the it takes care of prevention, promotion, and public health issues in the city of Madrid. And they have 16 centers all over the city that are devoted solely to health promotion and prevention. So we work with the one that is in Villaverde. And very interestingly, this is a pretty new facility where many of the workers that work there have been born and live in the area. So the connection to the area and to the population in the area is very tight. So through collaboration with them, from the very beginning of the grant writing and the developing of the project, we enrolled 24 participants from both neighborhoods. We enrolled men and women in different groups for two reasons. First, because we thought that men and women relates to food environment, food shopping, food cooking in a different way, which at the end we didn't find so many differences. But also because Spain is a very traditional society where it could be that men at the end run the conversations and end up not giving so much freedom and chance to women to explain whatever they wanted. So we segregated them by gender. I explain that because there's the typical question that comes all the time, and I think that's an important question. So we did that, and we built these 4 different groups, and the Photovoice process goes into several sessions. It could be 4 sessions or 7 sessions. In this case, we split it into 5 sessions, where participants in the first session take a crash course on photography. I'll show you a video later on with the participants playing with their cameras, and that's run by the photographer. And in the first session, we ask them, please take pictures of anything that has to do with food in your neighborhood. So don't take pictures of your refrigerator, of your mom, your dad, your children eating at home. We are interested in anything related to food outside your house, in your neighborhood. And then they come out and take so many pictures as they want. Some take 100 pictures, some take 5, and another ones take 1. And then they come the next week, and we ask them to choose the best 5 pictures, not best 5 in terms of aesthetics or how beautiful they are, but the most important ones that they think characterize their food environment in relation to the diets. And then they discuss all these pictures, they come out, they take more pictures, and they come back, and then they keep on discussing. All these discussions and group dynamics are audio taped. And in the final sessions, they split those themes, those thematics, those pictures that they have been taking, they split them into positive aspects of the food environment and negative aspects of the food environment. And in the very final session, they put all the pictures they have chosen. Each one has the choice of one photograph of themselves, and each group can pick another 1 or 2 pictures that they think is important to explain what is going on in the neighborhood. And then they take all those pictures they have chosen and they put them into main themes, into main categories that they think that they are discussing most in their groups. So you see all these people discussing and puzzling and moving around their printed photographs. We have a printer there, color printer, and we play around with them. So they took a total of 163 photographs. All 4 groups together identified 30 categories from their discussions and their pictures. And those 30 categories, then 4 of us in the research team got together and collapsed them into 5, or organized them into 5 main themes that put together the main characterization that the participants did. And we came out with these 5 main themes, which are eating in moderation, cultural diversity, the type of food stores present in the area, social relationships in terms of, or in relation to the way people do eat, and the fact that the economic crisis and poverty shape the food environment and shape also the way we eat. So those 5 themes are the 5 main chapters of the book that you have, and those are the 5 main results of the first paper that we are working right now and is currently under review, and Julia, that is there for any questions for you, has been writing. So I'll show you some of the pictures and some of the reflections that the participants did on this process. And again, this is the first layer of analysis, which is actually their analysis. So it's not our analysis; it's what they thought about at the very end of this process that altogether took like 4 months for you. So this participant, he was telling all the time about this idea that we are surrounded by food that we already know that we should not be overeating. So in this case, the title of the picture was A Delicious Dish of Chorizo. So this man, he said, I love to go with my friends to this bar, and we have a great time. And I know, because my cholesterol is high, that chorizo is not what I should be eating, but that delicious dish of chorizo is there, and I'm looking at it all the time, every Monday and every Friday, and have a very close relationship to it. And some days I want to eat the whole dish, some days I just want to eat half of it. So he was talking about this struggle, very human struggle with the dish of chorizo. And the same thing came out with a family, with a woman from Morocco that had a family, and she goes every day by a bakery that nowadays is really, really cheap to buy cheap baked cupcakes and things like that in Madrid. And she fights every day. Should I buy them? Should I not buy them? It goes with the kids. Should I buy them once a week, once a month? It's so cheap. So they were reflecting on this continuously. So that's why it ended up as one of the themes. The second theme that came out all the time is cultural diversity. And cultural diversity, it's interesting in the sense that this is an area where I always say that this is the only neighborhood in Madrid that reminds me of New York. Because when I go to New York, I love Queens. Those that lived in Brooklyn, please forgive me. But for some reason, I love Queens. And I think one of the reasons why I love Queens is because it's so vivid, it's so mixed, it's so vibrant, and it's so many people from different places live in that area. And the only place where you can see that in Madrid is in this neighborhood. So they were all the time talking about that. And the interesting part is not that they said, like here, this is cassava and this is melon. So this is what Spanish people would buy and this is what Latin American people would buy. It's also the fact that our traditions in eating, say tortilla de patata, there's another picture of tortilla de patata in the book, is part of the cultural diversity of the food in this area. But also, for example, kebab or pizza or hot dog. And no Turks, no Americans live in that area. But that's part of what we eat, and that's part of the cultural diversity that shapes the food environment of where we live nowadays. Food stores, we know a lot about food stores in Madrid, many different mercados, mercadillos, we call it mercadillos. These are street markets that for generations have been there, in this case, Thursday mornings. So people go there, gather, buy their food on a weekly basis, and buy this food. And many of the, both men and women of the participants were talking about the relevance of these places. In this case, this picture turned out to be a really beautiful one, and it actually made it to the largest newspaper in Spain. And this participant was quoted as the photographer, and that was a big hit of the project at some point. Social relationships and eating, social relationships and gathering, social relationships. You saw that man talking about his friends going to the bar. Social relationships, particular immigrants, they get together and they go to the park. They go to the park for being together and sharing food, but also sometimes they cook food at home and they sell it to their peer friends in the parks. Very interesting conversations come here from, is that good, is that bad? What do immigrants think about that? What do Spanish-born people think about those activities in the parks? I was very surprised about how gentle and respectful those conversations were, but that tension was all the time in most of the groups, and actually comes out on the video as well. Finally, the fact that Spain, especially these areas, these underserved areas, have been hit very hard by the economic crisis. The fact that poverty is everywhere to be seen, everywhere to be understood. There was actually 3 people including our photographer, took pictures similar to this one, and very interestingly, when we put together all the participants together to share these pictures, they were talking about this from a historical perspective, from the different neighborhoods. So this was all the time present in the conversations. So those were the main analysis that they did. We didn't do it. Photovoice is about being the funnel for the researchers of the voice of these participants, and through photography tell us what they think is important. So that's the first. That was our first analysis, and the second analysis is how we wanted to see how all this data, how all this information can translate into food policy recommendations for the local administrators. So in this case, another researcher from our group, Maria Ortasun, met twice with all groups together in this case, and aimed to translate these results into policy recommendations. They used what is called problems and objectives analysis, using a logical framework approach. And the way this is done is they identify the root and causes for both positive features of the food environment that they should be encouraged, and the root and causes of negative characteristics of the food environment to be addressed and changed. So, for example, if the participants identified a problem of having insufficient access to a variety of food with suitable quality and affordable prices, then they were discussing what are the roots or the causes for that. And well, they discussed that. And for example, they came out with a solution that is the promotion of small food retailers in both neighborhoods. They came out with that recommendation. So through this project, we ended up with 11 recommendations that again are in the book. And not only they came up with those recommendations, but they also scored and ranked those recommendations. And they ranked them and prioritized them in terms of time that it would take to implement that recommendation. What would be the impact, so the social or the population impact of that recommendation, and for whom? What would be the feasibility of taking that action? And what would be the cost of of bringing that recommendation into place? And finally, those 11 recommendations were ranked, and this is what we presented to the local administrators. So these recommendations went from offering local leisure time activities different than snacking, drinking alcohol, or sitting around. Improving food banks and food banks management in the area. All of them knew that food banks existed. Some of the participants actually were users or part of the food banks system.
Can you explain what the food banks are? Exactly what is this?
How do you translate that in
Soup kitchens.
soup kitchens?
Right.
Or
So people get food there,
Yeah.
get free
Right.
food.
so some people donate the food and then it gets distributed. And the problem with that, and I think, well, the picture is there. I don't have it here. One of our, several of our participants, but one of them was part of the food bank, not just user, but also organizer, took a picture and wanted to tell us about how this works. And the fact is there are many of them in this area in Madrid, but there are plenty of them in whole Spain and Madrid in general. But nobody has, up to now, tried to organize how they should be set up, which type of food, how do we improve the distribution system. Local authorities don't even know how many are they, and sometimes they are associated to interests that we don't know. So some of them are very religious, some of them are very ideologically organized. So this is something that people right now in the local administration are thinking very hardly about that. Yeah.
Sorry, is it prepared meals or is it like grocery?
Groceries.
Okay.
So at the end, it's mostly canned food, legumes, tomato cans, and maybe olive oil or something. Yeah.
And just to be clear, so they're not at all associated with the government or funded by the government. These are private initiatives, maybe charitable or things like that?
Yeah. Yeah, mostly run by religious communities, also by local grassroots organizations, or even some ideologically organized associations. So another one that they coincided, reactivating traditional markets and small retailers, improving food hygiene conditions, promoting the availability of organic foods and foods specific for patients as diabetics or celiac, people with celiac disease. Something that they talked all the time about reducing food waste. And reducing food waste, very interestingly, is a problem now. It's a global problem. It's not just a problem of this neighborhood, it's a problem for Madrid, it's a problem for the European Union. There's a lot of talk about how do we regulate this. France is one of the first countries as a whole that is working on how to regulate that. Improving nutrition labeling, that's a global problem. We always come with the next level of nutrition labeling, but none seem to work. Offering healthier alternatives to workplace and vending machines. They took a lot of pictures of that. Teaching food education at schools, promoting healthy social networks for older people. Older people were all the time on the concern of this community, and giving street vendors legal status, because actually there's a lot of street vending or food being sold on the streets. So the final aim was to disseminate and communicate these results as a fundamental part of any Photovoice project. So we did that through the photo book that is available online. We have an exhibition that right now has been for 6 months in one of the main museums in Madrid. We have a video that I will show you in a minute. We have put together citizen science meetings, and we have an interactive cartography that I would like to show you right now. Many of these participants participated in, participated in the media collaboration, and here they are at the Cadena Ser, which is for you guys like NPR. So it's like by far the radio that is mostly heard in Madrid. And you can see that they're very proud of what they were doing and very proud of their book. And this was very interesting. Well, you can see that I never stopped talking. So this whole Photovoice project has been awful for me because you have to stay put in those meetings. And then I went to the radio and I made it to the main radio in Spain. And then the guy who runs the show is a very, very good broadcaster. He said, no, it's not about you, it's about them. Yeah, again, Photovoice is awful. And they asked all the questions to them but that's the point of Photovoice. So here you have the book. You can download it from the web. I brought a couple of you that you can a couple of them that you can keep them here. The exhibition went first to those two neighborhoods and then came to the very center of Madrid, which is still hanging there. And this is the mayor. This is Manuel Carmena. This is the mayor of Madrid. She cares a lot about that area, about Villaverde, so she went to Villaverde at some point for other reasons, not for the Photovoice. So they came and talked to her, and she knew about this project, and they took the picture with her. She's a very serious person. She looks very serious. Never laughs. And one thing that we organized is this what we call citizen science meetings, and this was very interesting. We brought together all the participants with local administrators. So this guy here with the hands up is the district elected person for the district. The guy that is trying to hide there is the health commissioner. He is the director of the. He was hiding even better. There's the director of the Institute of Public Health, and he's the head of prevention and promotion. And here, two of us, we were just moderating what all the participants were telling all these people in terms of, they went through 6 of the main, or the highest ranked recommendations. They took 3-4 minutes to explain each of these recommendations to them. And then the public was here, we were like around 50-60 people, and it was very impressive to see how gentle and respectful the whole process was. And we did that also in when we presented finally the book in the City Hall for a second time. So part of the dissemination of this project is through this interactive cartography that I want to show you. Is in our webpage. So what our fellow geographers in the team, they did is through their server at the university, they put together these maps where you can see, so this is the area of the project, as you saw before. For example, you can see here, for example, the education level for the area. So this is percentage of people with low levels of education. This is Madrid, would be like 7%. The whole area, the whole district of Villaverde would be like 30%. But if you go to the area where we were working, which were these two, it's around 32 or 39%. So you can see the demographics in terms of different population density, aging, immigrant population, etc. And finally, here what you can see is if you go to any of this, and this is open again in our webpage. It's in Spanish, I'm sorry. Spanglish is the official language in the Triple H. So if you go, for example, to this, you click there, and you will see not just the picture that you saw, but also, interestingly, you have the audio of the discussions that they had.
Hay mucha variedad de fruta, mucha variedad de precios y hay mucha competencia en el mercadillo. Y entonces cada uno tiene un precio. Y la calidad de fruta, porque ahora mismo ahí en otros mercadillos se ve también calidad de fruta, pero no es la misma.
So Juani was explaining there how the quality of the fruits can be variable between kiosk and how important that place is for buying food for her family, etc. So all of these pictures come with the questionnaires that they used individually, and then to discuss with them, and then the person who took the photography. And this is like the audio version of the photo book. So right now we are writing different bunch of papers. The next one that Julia is working on is to see, well, if we go and work on the food environment the same way that we did before, or that I did in terms of like identifying what type of stores, which is good, which is bad, that's one way to work. The other way is to understand how people relate and what is the meaning for the people living there of those resources, and then how to understand that from a subjective and objective perspective. That's something that we struggle a lot in neighborhoods and health research. And in this case, we are trying to do this from those qualitative and quantitative, from this mixed methods approach. Another analysis, another paper that we're writing right now is about the process of participating in the Photovoice project. And this was done by another student of ours, a German student, that she's a medical anthropologist. So she was interested in the empowerment process of the actual participants. So in this process of participating in your neighborhood through photography, through discussing with your peers, is this something that is interesting for you as an individual? So for that, she interviewed 10 of the female participants in the project. And she was very interested in understanding how this process could help them to gain knowledge in terms of nutrition or knowledge about their neighborhood, how maybe their self-perception would change because they became somebody important in the area. And remember that these are communities that are really small, where some of them, everybody knows each other. And maybe also in the sense that maybe now they have more access to local resources, to other people, to social networks, or to the public services that are in the area that they didn't know before. So what she found through these interviews is that yes, in all these three dimensions, women that participated in the process thought that they had gained and that they were empowered in those three dimensions. Finally, we were in love with this process and this project, and we thought that now we could ask for more money, as usual. It's like those papers that always end, more research is warranted. Well, more research is warranted to understand how the urban environment relates to physical activity, which is another domain, in this case, that Pedro Bullón, that is here with you guys, we shared him until Christmas with you, will be working on, following the same methodology. So as conclusions, we thought that it was a very successful way to engage residents in this type of participatory action research, and we engaged them not just to collect data, but also to analyze this data and communicate this data, and even these people are not just going to the media and not letting me talk to the microphone, but they're also writing the papers with us. And the first paper will come soon with one of the participants being co-authored. We think that they identified 5 themes that are really relevant for us to understand how the food environment relates to residents' diet. We were finally able to translate into these policy recommendations that right now we're writing the report, a full report for the city. And we did all those efforts in terms of communication. Some of them were better than others. And I'll show you right now. The video that we produced. So you can see the actual actors of the project.
La metodología Photovoice es principalmente una metodología participativa, donde, digamos, en este caso, los residentes de un barrio de Madrid son los que tienen, digamos, la voz y son los personajes principales que nos cuentan sobre el entorno de su barrio y lo que nos interesa a nosotros en este momento, que es la dieta o la alimentación.
Tiene, según su creadora, como 3 grandes objetivos. El primero, que la comunidad, que la gente que está participando en el proyecto y haciendo fotos pueda hacer un diagnóstico de sus necesidades y de sus capacidades. La segunda, generar una reflexión a través del diálogo crítico de esos equipos, esos grupos que van a estar haciendo fotos y debatiendo de manera conjunta, que eso contribuya al empoderamiento de esa misma comunidad. Y por último, informar a los decisores políticos de qué es lo importante para la gente que está participando en ese proyecto.
Esto y una puntualización. Esta la hemos sacado, pero yo esta no estaba y yo esta la tenía para desarrollar como algo negativo y estamos con lo positivo.
Podría pasar entonces al otro bloque.
No, pero como lo vean.
Pero la diversidad yo no la puedo ver como negativa, la diversidad.
La considera negativa.
Yo pienso que tiene muchas ventajas y así lo estamos transmitiendo o lo vamos a transmitir a las personas que quieran participar. Primero van a tener la oportunidad de tener una mini formación en fotografía y cómo se puede hacer, digamos, una técnica fotográfica.
Pero sale borrosa, mira.
Una vez terminado el proceso grupal, trabajamos con las personas participantes para escribir y publicar un artículo científico con los resultados principales del proyecto Photovoice. También estamos analizando en otro artículo las barreras y oportunidades del entorno alimentario en Villaverde, combinando un análisis de la accesibilidad, precio y variedad de alimentos saludables mediante observación social sistemática con las perspectivas de los residentes.
El proyecto Photovoice Villaverde ha demostrado la importancia de la participación ciudadana en proyectos de investigación en salud urbana. Si lo que queremos es demostrar cómo mejorar la alimentación, la comida en una ciudad como la ciudad de Madrid, es clave que conozcamos y participen los ciudadanos, los residentes de la ciudad de Madrid, contándonos qué es lo que ellos entienden por una alimentación adecuada y cuáles son las posibilidades que tenemos en nuestra ciudad para mantener una dieta saludable.
Lo más importante de esta técnica es que convierte a los participantes en portavoces de su propia realidad a través de la fotografía.
Después de los talleres de fotografía, el trabajo de campo y las sesiones de debate, los participantes junto al equipo de investigadores llevan a cabo una selección de las fotografías más representativas de las categorías de análisis, por ejemplo, crisis y pobreza, vida social o envejecimiento, entre otras. Esas fotografías se presentan finalmente en una exposición itinerante y en un fotolibro. En esta ocasión la exposición no solo se ha presentado en el Centro Cultural Santa Petronila de Villaverde, sino que también en Centro, en el Palacio de Cibeles. De este modo los vecinos de Villaverde han tenido la oportunidad de presentar su trabajo en el corazón de Madrid.
En la parte final de nuestro estudio abordamos el objetivo de traducir los resultados obtenidos en las etapas de discusión y análisis en recomendaciones para el diseño de políticas públicas sobre el entorno alimentario. Ayudados por la metodología del enfoque imacológico, las personas participantes y los investigadores tradujimos los resultados obtenidos en 11 recomendaciones, que después comunicamos al resto de la ciudadanía del distrito y a los decisores políticos locales.
Una vez terminado el proyecto Photovoice, hice entrevistas con las mujeres de Villaverde para ver si la participación en el proyecto generó algún cambio en su empoderamiento. Y se observaron cambios positivos en los 3 ejes estudiados. Un incremento en el conocimiento y la concienciación en relación a su barrio, la transformación de su autopercepción y la creación y utilización de nuevos recursos, como por ejemplo las redes de contacto.
Este proyecto se encuadra dentro del concepto de ciencia ciudadana, es decir, los investigadores, la ciudadanía y los políticos, los administradores políticos, trabajan de manera conjunta para producir conocimiento y acciones que tengan el mayor impacto posible para mejorar nuestras ciudades.
That final meeting was at the on the city hall, where they presented, where we gave their photo books to them, and they discussed once again with the city hall people. So as you have seen, these people have been fundamental on the work, and we started a year ago, and some of them they're still collaborating with us. And we are very grateful for that. And there's plenty of us that also worked on this project. We have geographers, photographers, person who did the photo book. We even have a sociologist. Sometimes we struggle with sociology, but we try. And all these people down here is from the Institute of Public Health in Madrid, and they were fundamental on working on this. We collaborated with public health people, but also with the city hall that funded and paid for the photo book and the exhibition. The European Research Council, which was the original funders, the Fundación Mafre, who I still don't know how the hell they end up paying and giving us all that money. And thanks to you guys for having us over here today. The 4 of us are very happy to be here. Thank you.
Thank you. We have a few minutes for questions or comments. Manuel, you just calm people yourself.
What are the expectations of the participants, and perhaps your expectations as well, regarding the likelihood that these recommendations are going to lead to changes that they'll see in the food environment of their neighborhood within some reasonable period of time?
Yeah. So it was very fast since we finished the analysis of the last groups, and we got the recommendations that we got together with the City Health Commissioner and the people in the Institute of Public Health and the district the elected person for the district. And they already, at that point, they already identified 3 out of the 11 that they wanted to address. Maybe the 3 is not enough for the expectations of all of them. But truth is that we are already working with them in several of those recommendations. There is not a long history of food policy and food and local government dealing with food policies and food interventions in Madrid from the city hall perspective. So we are collaborating and communicating with them in a very good way and often. But how this will really get done is still a puzzle or a question. But the will is already there, and they heard it, and now we are producing a final, better fashion report, and we will present it publicly to them, to the people to the local administrators in the district, in the city, and to the regional government. Because some of the recommendations are not just to be implemented at the district level. Well, some of the recommendations are global level or even like European level. We are trying to bring this project to the European Parliament.
What about with the business community? Is there a role for small businesses?
That's a tough question and a problem to solve, because some of the recommendations recommend that local food retailers get improved, get support, but they were openly saying that they don't like some of the other businesses that are in place. Very specifically, they were saying that they love the old markets and they love the small stores, and they don't like the large, big supermarkets, which we know in Madrid right now that they share a big part of the food distribution and food business in any city, but in Madrid also. So actually, as we come back on the 25th, we have a public debate where one of the participants will be there. There will be a person from the supermarkets, a person from the local markets, a person from the small food retailers, and a person from the local administration to share not just this knowledge, but also the idea of how do we improve the diet of the people in Madrid. So we'll see what comes out of that from that meeting again.
Thank you.
So I wanted to ask, some of the participants took photos of other people in their community, and I was wondering kind of what are the ethics behind that in terms of publicizing these photos?
Yeah, one part of the photography workshop that they take on the first session is to know when do you need as a photographer to ask for permission, and they carry on their it's not called informed consent, but it's an image release form.
Prior to participating, did the participants have something in common? Did they want to see like a change in their food environment?
No, not really. Only one of the participants was somebody who was really, really concerned about food, about the quality of food, about cooking, etc. So when he signed up, it was very clear that he had a lot of things in mind, and he had an agenda, and he took fantastic pictures. But other ones signed just for the sake of playing with the camera. Other ones signed because they just took a nutrition and physical activity workshop in that public health institute center. Other ones signed because they thought it was a fun experience. Yeah. And we had a very large range of representation. We had people that I couldn't believe it. We had people that they didn't know how to write and read, and they participated. They were asked in these cultural centers. They were asked if they wanted to participate, and they came.
So, I think this mixed methods approach is really great, and I think I've looked a little bit at the sort of empirical or whatever food environment literature, and it seems like the implication of that research, where you basically look at densities or distribution, access to different food resources like supermarkets, the implication is sort of like, do people have access and how does that impact what they eat? The Photovoice thing, I think, opens up this whole other avenue of research or other avenue of inquiry where it seemed like looking at your recommendations, it's not really certainly not exclusively, but maybe not even mostly about access to food. You know, like how geographically far do I live from a supermarket? And so I'm sort of wondering what your big picture thoughts are on the implications of the Photovoice research for this whole pretty big line of like food environment research. And if the implications are maybe not so much, how do we sort of reconcile, I guess, the more traditional research methodology with the implications of like this?
Yeah, that's a great question and a very tough one that we are wrestling right now with it. Julia Diaz, that now is hiding under the table, is trying to write a paper about that. And when I first saw these recommendations, I again, because as a Photovoice researcher you have to say nothing, when they came out, I called Benjamin Caballero, who was the head of the nutrition department in Hopkins. I said, look, nothing of what we've been doing relates fully to what has come out. So what I think they're talking about a whole different, as you said, a whole different set of issues, a whole different set of ways into how do we live relates to what we eat, and I think that's a valuable part to understand how neighborhoods, how cities relates to the way that we behave from a health perspective. So we have to take it with carefully, but I think that's also the advantage or the main strength of this, that we all of a sudden we are faced with the reality of what people think about this, and I don't think that I think the good part of the Photovoice is a very thoughtful process. So people engage into this for months, and all the themes and the discussions are really well. They go through a process of concept mapping and thinking constantly about what they chose, and at the end they didn't choose it for any aesthetic reasons. They were very convinced that there's problems going on in their neighborhood, and those problems relate directly to how people eat. But again, I think it's a whole other paradigm. I mean, we're in this case we're not just looking at the causes of worse dietary pattern. It's a much more complex.
I know some of the problems we have in America with food are related to people not really cooking for themselves anymore, or sitting down and having a meal. Did you see anything similar with that in Madrid?
It came out, but it's definitely not a prevalent issue or a big problem right now. We aim to work with adults. I think that's a problem right now in Spain for younger people. Most of these people were like 40 and over, some of them around their 60s. So those are people that really do buy food and cook on a daily basis. Yeah.
So you generated a lot of recommendations, and they're all pretty big. So I was wondering, how do you strategize politically in terms of like, what are the windows of opportunity, or what policy levers do we pull, and then how do we prioritize which ones we're tackling?
Yeah. That is what Maria Urtasun is working on, and we are dealing with that, and that relates to the question from before. I think we need to sit with the local administrators, not just more often, but also with different levels of local administrators, and see what can we do. Mm-hmm. One of the main reasons why I want to bring this to Europe is to see what Europe is doing in terms of some of these recommendations. Food waste, agricultural policies that relate directly to the prices, etc. Those are very important parts of the food system, but we're never going to be able to solve any of that just at one level. Mm-hmm. So, and the recommendations were not generated by us; were generated by them, which again shows how much knowledge people do have about important issues. So many of those recommendations are things that we struggle at USDA or that school of yours back in Maryland. So same things came up, or same level of problems.
While you were doing this project, did you discover any underlying health issues inside the community, or was it kind of what you expected?
More than underlying health issues were underlying social issues, very clearly outspoken. Health issues came out when, at the very end of the recommendations, when they said, well, what about if I am hypertensive? What about if I am diabetic? What about if I have an allergy? But that came out later on. What we found all the time is aging, even housing problems, poverty, crisis, the fact that people can have to take 3 buses to go to a cheap place, the fact that some people that have really struggling with food, or that they want really good food, they have to cross a big chunk of Madrid.
Maybe there's one more question, and then I think we have to wrap up.
You mentioned the collaboration between the planning department and public health department in Baltimore and kind of the strengths that were brought out of that. Is there any kind of collaboration between these departments in Madrid, or what can any of your recommendations were you considering that collaboration?
My feeling is that because in the US you have a very clear picture or a common idea that food, environment, current diet, obesity is a large social problem and a large public health problem. I think that that concern makes that local policymakers or local public health practitioners are very much aware of that. So they're more willing to listen about that and to act about that. My feeling is that in Madrid we are not ready yet to identify obesity with the food environment, obesity with local policies. Not even when we think about bike lanes and bike shares. We have been thinking and redesigning bike lanes and bike share systems in Madrid forever, or at least for the last 10 years, and there is absolutely no conversation of how much that relates to public health or to health of the Madrid residents. None. So I think that in that sense, the discussion, the public discussion is not very ready.
Okay, thank you very much.
Well, thank you.